Good afternoon. This is Eitan Shalom at the Body Mind Wellness Center, and I am just going to show you how I'm doing dry needling on my patient's jaw for his TMJ, and I am needling the trigger points of the masseter muscle and the motor points. And I don't know if you can see, it just so happens that here the motor point coincides with points that the Chinese were able to define already in ancient times, because they were doing work with their hands on the body. So they didn't call them motor points or trigger points. They called them Asher points. And then they also named them. So they're very specific points that can be used for internal medical purposes as well as myofascial problems. So here we are quickly on my patient here. What I've done is I have needled. This is the Chinese medicine point. These are in the masseter muscle. So this is the Chinese medicine point called stomach 6 in Western nomenclature. And this is the motor point of the masseter muscle. It's one motor point. So I've done that. But then what I also like to do, and I learned this actually from a body worker years ago who worked on my TMJ, is the masseter muscle starts there and goes there. So the fibers are going this way. Well, there's a wonderful technique called cross fiber that we do a lot. I do it on the upper trapezius a lot, where you needle across the fibers. And that's what I've done here. Sorry, this is my left hand. I'm trying to hold the camera and film at the same time. So this is going across. You okay? I'm going across the, oh, that feels really good. So this is called the lift and thrust technique, or also pistoning technique, where I'm going across the fiber. It's actually a place where the dentists will inject you when they're giving you anesthesia. And when I used to have TMJ, my dentist injected me there with anesthesia for some work he was doing. And I remember it jumped and I could feel it release. And with my mouth open and him inside my mouth, I said, "Thank you." And he thought I was crazy because it felt so good. And then here I'm doing another point on the, just underneath the arch here at the upper end of the masseter. So these are the points that I like to do on the front of on the face for TMJ. I will also do points in the temporalis up here, but he didn't have active points there. And I also do a point in the back of the jaw here towards the front underneath the earlobe, which I did earlier on him. So that's just a quick foray into using dry needling or acupuncture. This would be orthopedic acupuncture, if you want to call it that. It's really just depends what you call it, because what I'm doing is anatomical based needling of the trigger points to release the trigger points, and that's what dry needling is. But as it turns out, there are Chinese acupuncturists that do that too. They just don't call it that, and they don't even know about the trigger points. They just find them with their hands and call them Asher points. But the difference is the deep needling with the goal of releasing the trigger point, as opposed to channel theory. There are acupuncturists that would treat your TMJ that would not even needle anywhere on the face. That would be acupuncture. Thank you for tuning in. This is Eitan Shalom at the Body Mind Wellness Center. If you liked the video, please hit the like button. Feel free to comment and subscribe to the channel. Thank you.